Hello. This is Dr. Umesh Jalihal, Professor and Head of the Department, MS Ramaya Medical College, and Director, Karnataka Gastro Center. Today we are going to talk about GERD or gastroesophageal reflux disease. As you must have heard, GERD and gastroesophageal reflux disease are very common problems in the community, and we see about 10 to 20% of the people in the community suffer from this common disease entity. Largely it is thought to be because of change in the lifestyles people are undergoing today, and you all know that there is a lot of stress, change in the eating habits, eating junk food, eating food outside are largely responsible for the causation of GERD symptoms. Clinically, meaning how to recognize GERD in a particular patient. GERD patient will have heartburns, meaning they will have some kind of a burning sensation or warm sensation starting from the breastbone upwards towards the neck. And sometimes these patients may present with even excessive belching and some kind of vague abdominal discomfort, and sometimes they can present with chest pain, which may be even confused for serious heart attack. Besides this, sometimes they may experience difficulty in swallowing a particular food, especially the hard food, if they have the reflux symptoms which are long-standing. Besides the common heartburn symptom, less commonly we come across symptoms like hacking cough, throat pain, sometimes recurrent throat infections like pharyngitis, so on and so forth. These are some of the common symptoms of GERD that we see in a given patient. But this is about the symptoms. How a patient with a GERD should actually take care of himself. What we feel is, if they have noted these particular symptoms, as I mentioned just now, after eating a particular food, after their any party, it could be marriage function or it could be cocktail party, cocktail dinner with friends, they may experience this heartburn and belching or sometimes even regurgitation. They should actually seek proper medical attention and go to an appropriate physician or a gastroenterologist. And sometimes if they are not in a position to meet the doctor immediately, they resort to over-the-counter drugs, but it should not be done often. Once in a while, one could resort to drugs like the some antacids they can take to tide over the crisis, or certain proton pump inhibitors they may take. In addition to this, how to address the long-term symptoms alleviation in GERD patients. Basically, they have to resort to lifestyle modifications. They should not eat junk food. They should refrain from eating sour food items like tomato and even lemon, pickles, spices, masala food, especially food which is rich in masala, as we see in certain restaurants outside. And if they eat frequently in such restaurants, they may experience these GERD symptoms often. And in addition to this, they should not drink these carbonated drinks, so-called cool drinks, and also they should not take alcohol in excess. They should refrain from smoking, tobacco chewing, and to avoid this GERD symptoms. In addition, they should be careful, especially if they have problems like ischemic heart disease, heart problems, or asthma, chronic obstructive airway diseases, so-called COPDs. They will be taking a lot of medicines. Certain medicines also can cause the relaxation of the lower esophageal sphincter and can increase the symptoms of GERD. So such patients should be careful in choosing their antihypertensive medicines or so-called BP medicines, and the inhalation medicines for asthma, because they themselves can predispose for symptoms of GERD. In addition to this, they should be careful in taking this non-steroidal anti-inflammatory drugs, so-called painkillers, if they have some knee pain or some body pain, because they also can bring up peptic ulceration and gastroesophageal reflux disease symptoms. So this is about how to take care of the GERD symptoms without taking the medicines. And what do you expect when you visit to your doctor, especially the gastroenterologist? If a GERD patient with GERD symptoms visits gastroenterologist, usually we tell them to do this lifestyle modifications, just as of now I mentioned. In addition, we will tell them to take certain drugs and certain other lifestyle modifications, which I forgot to mention in my previous talk, are the head end elevation. It's a very important step in GERD treatment. You have to do when you go to bed, use a 6-inch wooden block and lift the head end of the cot, so that because of the gravity, the stomach acid doesn't go up into the food pipe and cause the GERD symptoms. That's one. And they should not eat the dinner and immediately go to the bed. Keep a gap of at least 3 hours between your dinner and going to bed. And you could even be careful when you lie on the bed, whether to lie on the right lateral position or left lateral position, or in the supine position, that is on your back. Preferably you could lie on one of the sides, preferably the right lateral position, to avoid the GERD symptoms. And besides this, I was talking to you regarding the investigations and how a patient of GERD will be evaluated when they go to a gastroenterologist. When we actually tell them to follow these lifestyle modifications, the treatment aspects without drugs have failed, then we think that whether they are having only gastroesophageal reflux disease or whether they have got any problems other than gastroesophageal reflux disease. So what are the other conditions which closely mimic gastroesophageal reflux disease? There is an entity called as non-cardiac chest pain, wherein the pain can be in the chest area. Patient may have pain in the chest area, but it could be because of the muscle, or it could be arising from the bones in that area, or it could be coming from the lungs, or it could be arising from the heart. Can be sometimes confused for the acid that is present in the food pipe, inflammation of the acid that is present in the food pipe. So we have to be careful about these things, and under such circumstances what we do is generally subject them for following investigations. The first and the foremost is the endoscopic examination, and endoscopic examination is going to tell us whether a particular patient has got GERD problem only or something else, or whether he has got any redness in the lining of the food pipe, or any ulcerations, or how is the valve between the food pipe and the stomach, is it very lax, or whether it is tight, or is there any hiatus hernia. All these things sometimes, if they are present, can predispose for GERD or gastroesophageal reflux disease. Besides this, we also can get sometimes some complications of long-standing inflammation of the food pipe, such as strictures. That means there will be narrowing of the food pipe because of the long-standing ulcers formation. Or there can be a particular change called as Barrett's. Here, long time exposure to the acid in the food pipe can transform the lining of the food pipe into a precancerous stage, which is called Barrett's change. So they have to be careful about this food pipe blocks or strictures or Barrett's change, or sometimes bleeding from the food pipe, which can present as blood vomiting or some black motion formation, etc. So, having dealt with symptoms of gastroesophageal reflux disease, having understood the complications of GERD, we have now told you like how to evaluate these patients with an endoscopy. One thing I want to tell you, many patients have some kind of a fear complex the moment we say endoscopic examination. Endoscopic examination is a very simple test, and these days we have the video endoscopes, which are very thin tubes, and we have got very sophisticated, flexible, non-traumatic instruments which are passed into the food pipe and the stomach, and the test would take just hardly about a minute time. And under such circumstances, we also give local anesthesia, and for apprehensive patients, we may give a short IV anesthesia, and the patient need not stay in the hospital for long. And it's a very simple test, and one need not be scared about this endoscopy. And sometimes in some patients who are having frequent symptoms in spite of the lifestyle modifications, in spite of taking drugs as sometimes they are prescribed, we have to go for the next level of investigations. That is what is called as pH metry. That means we do the acid studies in the food pipe, and we also do the motility studies. That means how the food pipe is moving when the food bolus goes into the food pipe. So if there is any movement problems in the food pipe or the stomach, then also one can get reflux symptoms. So it is they are better studied with this the instrument called as esophageal manometry. So patients who are having chronic GERD symptoms, who are not really relieved by the conventional medications and lifestyle modifications, are subjected for the second battery of investigations like pH studies, the manometry, and sometimes they are subjected for certain other studies like barium, etc. That's one. In spite of all these medications, in spite of all this conventional line of treatment for gastroesophageal reflux disease, very, very rarely when we give the medications and patients are not responding to the treatment, or patients become dependent on the medications for many years. And if the patient is young, say around 40 years roughly, and instead of taking the medicines for long and every day experiencing this GERD symptoms, sometimes we decide to send them for surgery. So what exactly we do when we do the surgery for the gastroesophageal reflux disease? As we talked about in the beginning of our talk, there will be laxity or the looseness of the valve between the food pipe and the stomach. So that's a basic problem in the GERD disease. So we are going to tighten that valve and repair that valve by doing keyhole surgery or open surgery. Most of the times it will be keyhole surgery called laparoscopic fundoplication. So in the laparoscopic fundoplication, again, in the best of the hands would take about less than an hour, and the patient will be kept in the hospital for 2-3 days. After that, patient will be asked to take the food, and they will be asked whether they have got any difficulty in swallowing food or whether they have got any reflux symptoms. So once there are no problems, once there are these symptoms are not there, and the patient recovers from the surgery, patient is able to walk, they will be discharged home. So the advantage of doing this fundoplication or undergoing this anti-reflux surgery is that one need not take the medications for so long, and they need not undergo the frequent tests, and to some extent they can be little eased out on the lifestyle modifications which usually they had to follow. So that's about the symptoms, investigation, how to diagnose a gastroesophageal reflux disease, and what is the treatment, the drug treatment, and the surgical aspects. I just mentioned about the drug treatment. Now I thought it's appropriate to go into the depth of the medications, how actually we begin, how long we give, and how we actually stop, or when we stop the medications. Actually, I should have told this a little before doing the surgery. The common medications which are used for gastroesophageal reflux disease are the antacids, H2 receptor antagonists like ranitidine, famotidine, so on. And the next group of drugs are proton pump inhibitors. In this category, we have starting from omeprazole, we have pantoprazole, lansoprazole, we have rabeprazole, esomeprazole, and of late we have elaprazole. And this particular group of drugs are called as Ramabana, and ultimate treatment, effective treatment options in the treatment of GERD or gastroesophageal reflux disease. What these drugs generally do is they block the final common pathway of the acid secretion. Excessive acid secretion in the stomach is one of the main culprits responsible for the GERD symptoms. So the proton pump inhibitor drugs will suppress the acid, will decrease the symptoms of GERD, and they will go in the long way in the treatment of GERD. So that's about the GERD symptoms. And regarding the awareness of GERD, as I began my talk saying that GERD is a very common problem in the community, and we should take a lot of corrective measures, lifestyle modifications. And also I wish to tell at this juncture that recently we conducted a World Digestive Day, World Health Digestive Day, and the main theme of this year's World Digestive Health Day was heartburn and its global perspective. The very fact that this theme was taken up, because looking at the magnitude of the problem in the community, and we conducted a lot of public awareness campaign to message and to spread the message of this heartburn which is prevalent in the community. Thank you.